So, thinking about getting that master's in public health? It's definitely a big decision. We're talking about investing serious time and money into your future.
Absolutely, and it's not a decision to take lightly. I've been hearing from a lot of people wondering if an MPH is really worth it these days.
That's exactly what we're going to explore today. We'll break down everything from those eye-popping tuition costs at top programs to what you might actually earn once you graduate.
And don't forget the different paths you can take. There's such a range of options now, from those prestigious private universities to more affordable state schools, and even online programs.
Plus, we'll look at how it all plays out differently for U.S. students versus international students. The math can change quite a bit depending on your situation.
I think what's really important is that people understand exactly what they're getting into. Whether you're aiming for those high-profile research positions or planning to work in community health, the ROI can vary dramatically.
Let's dive in and look at all the angles. By the end of our discussion, you'll have a much clearer picture of whether an MPH makes sense for your goals and circumstances. Let's start by talking about those prestigious programs everyone's heard of. You know, the big names in public health education.
Right, the ones that immediately catch everyone's attention. Johns Hopkins Bloomberg School of Public Health, Harvard T.H. Chan School of Public Health, Columbia Mailman.
Don't forget UNC Chapel Hill's Gillings School. These institutions have incredible reputations, amazing research facilities, and powerful alumni networks.
But all that prestige comes with quite a price tag, doesn't it?
You better believe it. We're talking about $60,000 to $70,000 per year just in tuition at these private institutions.
Wait, just tuition? That doesn't even include living expenses, books, and all the other costs?
Exactly. When you factor in living expenses, especially in places like Boston, New York, or Baltimore, you're looking at a total investment of $150,000 to $180,000 for the whole degree.
That's a massive investment. What are students actually getting for all that money?
Well, you're getting that prestigious name on your diploma, access to cutting-edge research opportunities, and connections with some of the top minds in public health.
And I imagine the career services and networking opportunities are pretty extensive at these schools?
Definitely. They have strong relationships with major organizations, CDC, WHO, major research institutions. Their alumni are everywhere in the field.
But is that enough to justify those costs? I mean, we're talking about the price of a house in some parts of the country.
That's the big question. These schools often argue that their brand recognition and networks can fast-track your career, but it's still a huge financial commitment.
And I'm guessing most students can't just write a check for that amount. They're taking out loans, right?
Most definitely. The majority of students at these top programs are financing their education through a combination of loans, scholarships, and maybe some savings or family support.
It really makes you think about whether the prestige is worth the price, especially when there might be more affordable options out there.
Let's talk about what graduates can actually expect to earn after making such a big investment.
That's really what everyone wants to know. When do you start seeing returns on all that education spending?
Well, starting salaries for MPH graduates typically range from $50,000 to $70,000, depending on your specialization and location.
That seems a bit low considering the investment we just talked about.
True, but there's usually good progression. After 5-10 years of experience, many public health professionals are earning $80,000 to $100,000, and some specializations can go even higher.
But in those first few years, you're dealing with those loan payments, right? What's a typical debt load looking like?
The median debt for MPH graduates is around $50,000 to $55,000. But if you attended one of those expensive private schools, you could be looking at $70,000 to $100,000 in loans.
That's daunting. How do people manage those payments on an entry-level salary?
There are actually several options. Many graduates start with income-driven repayment plans, which adjust your monthly payments based on what you're earning.
That helps during those early career years, I imagine.
Exactly. And here's something really important, the Public Service Loan Forgiveness Program, or PSLF.
I've heard of that. How does it work for public health professionals?
If you work full-time for a government agency or nonprofit organization, make 120 monthly payments, that's 10 years, the remaining balance gets forgiven.
Given how many public health jobs are in government or nonprofits, that could be huge.
Absolutely. It's a major factor in making the degree financially viable for many people. Plus, while you're working toward forgiveness, those income-driven payments keep things manageable.
Are there any other loan repayment programs people should know about?
Some employers, especially in underserved areas, offer loan repayment assistance, and some states have their own programs for public health professionals.
So it's really about playing the long game, managing those early years carefully while working toward better positions.
Right, and being strategic about where you work. Sometimes taking a lower-paying job at a qualifying organization can actually leave you better off financially in the long run because of PSLF. Let's talk about more affordable ways to get that MPH. Not everyone needs to spend six figures at a private university.
What are some of the alternatives?
State universities are a great option, especially if you're a resident. You're often looking at tuition around $18,000 per year, less than half of what private schools charge.
But does a state school MPH carry the same weight with employers?
Many state schools have excellent public health programs, and honestly, in this field, your experience and skills often matter more than where you got your degree.
That's good to know. What about online programs? Are those legitimate?
Absolutely. Many top schools now offer online MPH programs, and they're the same curriculum and quality as on-campus programs.
What makes online programs particularly attractive?
The flexibility is huge. You can often keep working while you study, which helps with costs. Plus, some online programs are incredibly affordable.
How affordable are we talking?
Some programs cost just $12,000 to $15,000 for the entire degree.
Wow, that's a fraction of what we were discussing earlier.
Right, and because you can keep working, you're not losing 2 years of income either. It's a complete game changer for the ROI calculation.
Are employers okay with online degrees?
These days, absolutely. Especially since many prestigious universities offer online options. The key is making sure it's an accredited program.
So you could potentially get the same education, keep your job, and spend way less money?
Exactly. For many people, especially those already working in healthcare or public health, it's the perfect solution. Now let's dive into MPH specializations. This is where your career path really starts taking shape.
Which specializations tend to offer the best opportunities?
Epidemiology is a classic choice. These professionals typically start around $50,000 to $65,000, but the median salary is about $78,000. With experience, especially in leadership roles, you can definitely hit six figures.
What kind of work do epidemiologists usually do?
They work in health departments, the CDC, research institutions, and even pharmaceutical companies. It's a stable career path with good job security.
What about biostatistics? I hear that's where the money is.
You heard right. Biostatisticians are in huge demand. Median salary is around $99,000, and entry-level positions start at $65,000 to $80,000. Plus, it's often STEM designated, which gives international students more work opportunities.
Those numbers are impressive. Are there other high-paying specializations?
Health policy and management is another strong option. Entry-level analysts start at $60,000 to $75,000, and experienced managers often make over $105,000.
What about specializations that might pay less, but have more direct community impact?
Environmental health is a prime example. The median salary is around $76,000, but entry-level positions often start at $45,000 to $55,000. Community health roles typically start even lower, around $40,000 to $50,000.
Quite a difference from biostatistics.
Yes, but remember, some people prioritize making a difference over making money. Global health specialists might start at $45,000 to $65,000, but they're working on crucial international issues.
How about more specialized areas like health informatics?
That's another high-earning path. With the growing importance of health data, informatics specialists can command salaries similar to biostatisticians, especially if they have technical skills.
So it really depends on what you value most, earning potential or social impact.
Exactly. Each specialization has its own trade-offs between salary and type of impact. The key is finding what aligns with your personal goals and interests. Let's compare the MPH to other master's degrees in the health field. The Master of Health Administration, or MHA, is a big one.
How does that differ from an MPH?
MHA graduates typically earn more right out of the gate. We're talking $80,000 to $100,000 starting salary compared to $60,000, $70,000 for most MPH roles.
That's a significant difference. What about MBAs with healthcare focus?
Those can command even higher salaries, especially in consulting or pharma, but they're expensive, often over $100,000 just for tuition.
Some people do both, right? MPH and MBA?
Yes, though that means double the investment. Then there's the Master of Social Work, MSW. Different focus, usually more direct service, but typically lower salaries unless you become a licensed clinical social worker.
What about the Master of Public Policy or Public Administration?
MPP and MPA salaries are usually comparable to MPH, but they're more focused on policy and governance rather than public health specifically.
And the Master of Science in Epidemiology?
Similar salary to MPH Epi concentration, around $78,000 median, but it's more research-focused and often shorter, maybe 18 months instead of 2 years.
So each degree has its own trade-offs?
Exactly. Higher salaries often mean higher tuition costs, and more specialized degrees might limit your career flexibility later on. Speaking of costs and career paths, international students face some unique challenges when pursuing an MPH in the US.
What are the biggest hurdles they need to consider?
First, there's the financial aspect. They usually pay out-of-state tuition rates and aren't eligible for federal loans or grants.
How much do they need to prove they have access to?
Usually around $70,000 just to get their student visa approved, and that's before considering living expenses.
What about after graduation? How does the job search work?
They typically get 1 year of optional practical training, or OPT, to work in the US. After that, they need an employer to sponsor their H-1B visa.
Are many employers willing to sponsor?
Larger organizations like hospitals, universities, and big corporations are more likely, but government jobs, including the CDC and local health departments, usually require US citizenship.
Are there ways to improve their chances of staying?
Yes, choosing a STEM-designated MPH program can extend their OPT to 3 years instead of 1. And networking is crucial, especially during internships.
What about working in academia or research?
Those sectors are often more open to sponsoring international employees. It's tougher overall, but there are definitely paths to success. After exploring all these aspects of getting an MPH, I think it's clear there's no simple yes or no answer to whether it's worth it.
Right. It really depends on each person's situation, goals, and what they want to achieve in public health.
Exactly. The MPH isn't just about the financial return on investment, though that's important to consider. It's about making a meaningful impact.
Whether that's through research, policy work, or directly helping communities.
And while some specializations might offer higher salaries, like biostats or health informatics, others provide different kinds of rewards.
Like the satisfaction of improving community health or fighting global diseases.
The key is finding that sweet spot where your passions align with sustainable career opportunities.
And being realistic about the investment required, whether that's time, money, or both.
For anyone considering an MPH, my advice would be to really research the programs, talk to alumni, and understand the career paths that interest you.
And remember that public health needs passionate people, regardless of which path they choose to take.
That's what it all comes down to, using your skills and knowledge to make the world a healthier place.
Thanks everyone for joining us on this educational dive into the MPH journey. Here's to making informed decisions and positive impacts in public health.